Hello everyone, I am Dr. Anvi Vaidia here at the Henry W. Block School of Management. We are doing Well Talks today, and joining us today is Sarah Heavey. She is a CCU nurse, a cardiac critical care nurse. And let's talk to Sarah about CPR today. Hi Sarah, would you like to
Hi.
introduce yourself?
Sure. My name is Sarah Heavey. I'm an ICU nurse. I specialize in cardiac care. I've worked in an ICU for about 10 years, and I'm currently obtaining my master's in acute care and will be a nurse practitioner very soon.
That is really interesting. So let's talk a little bit about how you decided to become a nurse.
Sure. So I really like science, particularly physiology. And in college, I really enjoyed that course. And I also really like people. So I figured that nursing may be a good mix of those two, physiology and science, and still caring for people, which
Absolutely.
I really
Absolutely.
like.
That
So
is wonderful.
that's how I decided.
So today we are going to talk about CPR. So let's start with basic life support, BLS. Do you
Sure.
want to talk a little bit about what is basic life support?
Sure. So basic life support would be providing compressions and rescue breathing to a patient who is undergoing cardiac arrest. This can be done in many settings, including outpatients, in a Walmart, on a jogging trail, or in a hospital setting. So it would be providing compressions and rescue breaths and summoning the correct help to try to rescue that patient from cardiac arrest.
Great, but you said that it can be performed anywhere. What are the things that you need for it? Is there any specific paraphernalia that you need to perform a CPR procedure?
So luckily, no. What you need are your arms and your lungs. So you're going to be providing compressions to a patient who's undergone cardiac arrest, and you're going to be providing rescue breathings in most scenarios for patients who have undergone.
That sounds
Cardiac
very
arrest.
promising. That is
Yeah.
excellent. What are the different steps that are involved in a CPR?
Sure. So when a patient presumably goes into cardiac arrest, you may, if we're talking about an outpatient scenario, you're going to want to make sure that patient is really in cardiac arrest so that you don't initiate CPR on a patient who's just lost consciousness. So the first thing you want to do is to pat the patient, shake them, and make sure that they don't respond to you and that they're really pulseless. They don't have a cardiac rhythm. The next thing that you can do in some cases is you can feel for a pulse. You can use your two fingers and feel up by the carotid artery, a little bit under the jaw and next to the trachea, and see for about 10 seconds if you have a pulse or not. If you don't have a pulse, then you're going to want to initiate compressions. While you're initiating compressions, hopefully there's somebody with you who can call 911 for you so that the rescue team can come and first responders can help you. But if you don't, you can initiate compressions and put your phone on speakerphone and call 911 at the same time. So once you initiate compressions, you're going to want to do those at a ratio of 30 compressions, nice and slow, and then give 2 rescue breaths. And I think we're going to demonstrate that later.
Wonderful. How would you assess if that procedure, the CPR that you're performing, is effective at all?
Yeah, so many times if you initiate CPR on a patient, you may not see the end result.
Okay.
What you want to do is, though, while you're doing compressions, is slow yourself down and ensure that you're giving CPR at a depth of 2 inches. So you want the chest to go up and down about 2 inches every time to allow for the heart to refill with blood in between compressions. So one thing that you can do is make sure that you take a deep breath and that you are performing compressions at a slow and regular rate.
Okay.
I shouldn't say slow, just a regular rate.
A regular rate. Wonderful. You mentioned a little while ago that let's hope there is somebody who can call 911 for you.
Correct.
Would you think it is important to have teams or teamwork in such situations? And if so, let's say you are at an external location where, let's say Walmart, like you mentioned. How can you gather a team, and what do those team members do and help you?
Oh, definitely. I think if you're at a Walmart and a bystander goes down, you may draw a crowd anyway, which is good because you're going to need someone to call 911 and to grab maybe an AED device, which is a defibrillator that can help get the patient out of a lethal cardiac rhythm. So yeah, when you're out in a group where maybe there aren't medical providers around, most of the time you will draw a crowd, and then you can point to someone and say, you call 911,
Right.
you go grab this, and you go grab the AED.
Oh wow, that is a
Yeah.
lot of interesting information. That
Yeah.
makes me feel really good about going down in some public place at least. We know that we will have people saving us, and just so everybody is on the same page, let's go ahead and do a CPR demonstration. We have a mannequin here today that Sarah will be demonstrating on. So let's hand it over to Sarah.
So this is presumably a patient that is found down, unresponsive, maybe gasping, breathing, but not really taking good breaths. So I'm going to first go to him and say, "Sir, are you okay?" And if he doesn't respond, I'm going to feel for a pulse for about 10 seconds, no longer than 10 seconds. Once I feel that he doesn't have a pulse, I'm going to begin CPR with doing compressions. And I'm also, since I am the only person who knows how to do compressions, I'm going to delegate to my friend here to call 911 and to grab me a defibrillator or an AED so I can shock this patient out of a rhythm if I need to. So after I've said, "Sir, are you okay?" and I felt for a pulse for 10 seconds, I'm going to get on his chest with both hands, one over the other, in the mid-sternum, and I'm going to compress 2 inches deep and allow the chest to come all the way back up. Okay, it's going to look like this. So you're going to want to do that 30 times, and then you're going to want to move, if you're the only responder, to the patient's head, tilt the chin back, and deliver 2 breaths down through his mouth. You pinch your nose, just like this, and you tilt the chin up and deliver 2 breaths. The ratio of that is 30 to 2, so you'll switch back and forth between compressions and rescue breaths.
And let me ask you a question. How much do you raise the chin? Like, where should the chin be located?
Right. So when you look at the patient, the way that you know your rescue breaths are working is that you lift the chin, pinch the nose, and as you deliver the breath, you look down the sternum to ensure the chest is rising and falling, and that's kind of how you know you've got the right position.
Okay, that is wonderful.
Yeah.
You mentioned calling 911 or grabbing an AED.
Yes, correct.
What else
So you
should we do?
can't forget to call 911 because otherwise no one will come and help you with this patient. So by alerting your peers, you can grab the rescue team and they can come and help you. The other thing is once you have the AED, it's okay to stop and apply the patches to the front of the chest here and to the side of the chest here. And the AED will let you know if it's going to deliver a shock or not deliver a shock.
And where would we place those pads? Is there a specific area on the chest or on the side that we have to look for?
Right. Luckily, on the AED, it will tell you exactly where it wants you to put the patches. Generally, the front one goes up here, and it shows you right on the pad, and the side one either goes on the back of the patient or at least far enough down on the side.
Wow, that was a fabulous demonstration, Sarah. Thank you very much. That actually makes me feel so confident about being in a situation where somebody needs CPR. I feel like I might be able to administer it really.
Great.
And that is a really good feeling.
Great.
And I'm sure that our students, residents, fellows, peers, everybody has learned from this today and that they will definitely benefit from what Sarah has taught us on the mannequin and in theory today. So thank you very much, Sarah. We really
you.
appreciate your time here today.
Absolutely.
We will see you again for ACLS, that is Advanced Cardiac Life Support, and we will talk more in detail about that. So
Very
thank
good.
you to you, and thank you to the UMKC Block School for allowing us to film here. Thank you very much.